The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and good morning, everybody. My name is Joshua Hudson and I'm with the National Native Network. Thank you all for joining us today for today's presentation. I would like to pass it over to Aaron Williams, one of our esteemed guests, to give us a quick welcome from the Southern Plains Tribal Health Board.
Yeah, good afternoon, everybody. Thank you for joining us today. I am Aaron Williams with the Southern Plains Tribal Health Board. I'm the Tobacco Program Coordinator for the Good Health and Wellness in Indian Country CDC funded grant. Appreciate everybody joining us to talk about smoke-free casinos in Oklahoma. I'm not sure if everybody's aware that there are 5 tribes that have currently gone smoke-free temporarily, with about 22 casinos that are smoke-free. And we're just here today to kind of celebrate them and talk about the benefits and some of the ways we can help increase those numbers. So without further ado, I'd just like to hand it back off to Josh, and we'll begin this webinar. Thank you.
Thank you so much, Aaron. So now I will pass it over to Chris Tallbear, who is Southern Cheyenne, and he is the Project Director for the Good Health and Wellness in Indian Country at the Southern Plains Tribal Health Board.
So, hi everybody. It's good. I wish I could see you, but if I can, you're probably a little square on my computer. But it's good that you guys are here. I thank you for giving us a little bit of your time. We look forward to hearing about this topic today. But before we begin, kind of like with a lot of our activities in Indian Country, I want to offer prayer, talk to the Creator on our behalf, and just ask if you guys will pray along with me. So I'll turn to the Creator. Creator. Thank you for all the blessings that you've given us. I thank you for bringing us all here to this, to this point in time. And I pray, that we have good health and long life for all of our people. I pray that you be with those out in our tribal communities that are suffering or that maybe are having a hard time, with this sickness going around, Creator. I pray that you be with our tribal leaders as they make decisions for the good of our people. I pray that you be with our, elected people, elected officials, that they can have some, some solidarity, and they can put the needs of this country before their own, Creator. And I just pray that, we all get a blessing out of today. I pray that you be with those people that need help. And if we've overlooked anything, I pray that you forgive us. And all these things we ask in your name. Amen. Thank you. Thank you. Kind of on that note, with talking to the Creator and kind of beginning out that way today, one of the things I kind of wanted to touch upon a little bit was that traditional tobacco use. We're here talking about, smoke-free casinos here in Oklahoma and hopefully out in the rest of the country as well, as other tribes kind of follow suit. But whenever we look back with our use of tobacco and kind of how it originated, a lot of times it was the show of respect, it was a show of friendship, it represented, contracts that we had, agreements between tribes or individuals, but we had it served a very important purpose, in our everyday lives. And sometimes maybe we drift off from it. We forget about what its intent was for, and I'm just kind of here today and at this point to try to, remind us, that's medicine, that what it represents, through these times with COVID and stuff. A lot of our people, we kind of don't travel as much, and whenever over the summertime we would see old friends or we would come to powwows or something like that, we'd put tobacco down, that sign of respect for that other individual, or maybe to renew, a friendship. But there was always that exchange, and we haven't really gotten to do that, this year, with what's going on out there in the world. A lot of families, they've lost loved ones. I can kind of relate to my own. I lost my dad about a month ago to this COVID, and my dad loved casinos, loved tribal casinos. It was, a lot of our elders, it's a place where they can go and they can kind of socialize, with people in their own age group. My dad was 85 and he was a smoker. He smoked his whole life. And, one of the things that came up when he got hospitalized was the fact that he had COPD. And, he was a welder his whole life, spent time in casinos, and you pass that risk on to workers out there, maybe people that don't smoke with secondhand smoking. But, it's something to kind of take note of. A lot of our old folks, they love that tobacco, they respect that tobacco, but sometimes we kind of get a little bit carried away. And my dad used to always tell me, those things are medicine, until you get to kind of abusing it, then it quits kind of having that effect. And sadly, I kind of think that's where my dad went, and we've talked about that. We had talked about that, and he really wanted to quit, but that addiction thing, it's a tough thing to break. But, with prayer, with that old, traditional support that we have, maybe we can help some of our people get back to that way that it was at one time, but as we kind of go into this discussion today, think about our old people, think about the ones that go into those casinos from your tribe. A lot of them smoke, or they're around smoke, tobacco, even if they don't smoke, and, that place that we use that tobacco should be inside that teepee or in that lodge or out there, whenever we're, bringing back those cultural ties. So I just kind of wanted to remind you guys that little bit about, traditional tobacco, and kind of speak a little bit from experience. Henehane, thank you. That's all I have to say. Guys, have a good webinar. Thank you.
Thank you so much for all of your words, Chris. They really mean a lot. So up next, we have Charlie Gagan, who is the Director of Advocacy for Texas and Oklahoma region with the American Lung Association.
Hey, thank you. Appreciate you all having me here. As Josh mentioned, I am the Advocacy Director covering both Texas and Oklahoma for the American Lung Association. And today I'll be covering 3 topics: smoke-free casinos, the vaping epidemic, and everybody's hot topic, COVID. Let's see here. There we go. So first off, the benefits of a smoke-free indoor air policy. So really, again, the problem is tobacco use remains a serious addiction and remains a leading cause of preventable death and disease in America, killing close to 500,000 Americans every year. In Oklahoma, that's about 7,500 each year. And nearly 20% of Oklahoma adults still smoke, with 1,300 kids becoming new daily smokers each year. And this translates to actual costs, roughly $800 per household in Oklahoma healthcare costs. So when people smoke and abuse commercial tobacco, it doesn't just affect them, it affects their entire community. Now, a smoke-free indoor air policy focuses specifically on secondhand smoke. Secondhand smoke is the combination of the smoke that leaves the end of a cigarette, as well, that's kind of the side stream smoke, as well as what the person exhaled mainstream smoke. And we know that secondhand smoke, the stuff they're exhaling, contains over 7,000 substances, many of which are known to cause cancer. In fact, the EPA has classified that secondhand smoke as a carcinogen, known to cause cancer. And there have been multiple Surgeon General's reports confirming the evidence that there's no risk-free level of exposure to secondhand smoke. And so that's what this indoor air policy aims to address. Again, this policy has several components, but it essentially just asks folks to step outside when they want to use a tobacco product. It does not allow smoking sections or separately ventilated areas. We know that smoke does not mind its own business. It doesn't stay just in a smoking section if you put a line up or a wall up. and it also includes e-cigarettes, which we really view as kind of the modern form of cigarettes. This policy benefits both employees and employers. We know that secondhand smoke exposure in the workplace has been linked to increased risk for heart disease, lung cancer among adult smokers. And a really kind of scary statistic for you is that an employee working in a smoking environment will inhale approximately a pack's worth of cigarettes in an 8-hour shift. So if you are, in the service industry working in a smoking bar or a smoking casino, even if you don't smoke on your own, just from your 40 hours a week at work, you're going to inhale about 5 packs a week. And so a smoke-free environment really helps those workers, those in the industry, those in the front lines who disproportionately feel those impacts of secondhand smoke. It also benefits employers, but this policy has been around for several decades, and there have been consistent studies that show that these ordinances do not have a negative effect, at least on bar sales. They generally seem to improve employee morale and health, and ultimately save the business not only money on healthcare, but on insurance, a lower likelihood of a fire happening, on cleaning costs, to regularly clean those air filters. And so again, we really have seen if not a positive, a net neutral on the impact on business when they pass smoke-free indoor air laws. Now, one of the most common questions we get is, well, what about these, air purification systems and ventilators? And we point to the American Society of Heating, Refrigerating, and Air Conditioning Engineers, the folks who build those systems. And they've stated that the only way to properly prevent someone from the danger of secondhand smoke is to simply ask them to step outside, that essentially those systems and ventilators are not effective. They do not do what they are advertised to do. And so that's why we continue to advocate the policy of simply asking folks to step outside. And so a key takeaway when it comes to smoke-free casinos and any indoor air ordinance is that they are good for employees, they're good for businesses. We've seen no negative impacts, and a lack of smoke-free indoor air laws hurts service workers the most. They are the ones most likely to work in those environments. They're the ones most likely to not necessarily have great health insurance to deal with the resulting problems that might come from breathing in that secondhand smoke. Moving on to the vaping epidemic, and as I mentioned earlier, we really view e-cigarettes are essentially a modern version of commercial cigarettes, and they are addicting an entire generation. Prior to e-cigarettes entering the marketplace, we had seen solid evidence of decreasing use of adult smoking rates, decreasing youth smoking rates, and all of that progress has been undone in just the past few years with the introduction of e-cigarettes in the marketplace. In Oklahoma, more than half of high school students surveyed said they have at least tried an e-cigarette, with more than a quarter saying they've used one in just the last month. When you compare that to traditional combustible cigarettes, only 34% have ever tried one, and only 9% have used in the last month. So more than 3 times the usage when it comes to high school students using e-cigarettes in just the last month. And that e-cigarette aerosol is not harmless. Virtually all e-cigarettes contain nicotine. We've even seen studies of e-cigarettes that are marketed as nicotine-free still having nicotine in them. And we know that nicotine exposure, particularly in the developing brain, can literally alter the way your brain deals with addictive chemicals like nicotine and make you more likely and more susceptible to a lifetime of addiction. And so that's why you've seen a lot of efforts in the last few months and years to raise the tobacco age from 18 to 21. It's because that serious concern about youth uptake and youth use, that once you start smoking an e-cigarette or tobacco product, you are very unlikely to ever put that product down. The reason this is such a problem is really because the FDA, the Food and Drug Administration, has been asleep at the wheel. The FDA, thanks to work from the Lung Association, was given the authority over cigarettes and smokeless tobacco products, and that authority was extended just a few years ago to include all e-cigarettes, hookah, all sorts of tobacco products. But unfortunately, the FDA decided not to regulate e-cigarettes, and it was only after several lawsuits that just this last month the FDA finally required all e-cigarette companies to submit their products for review and authorization. And so these companies have the next year to wait and see whether they are approved or whether they need to be taken off the market. And just to be clear, the FDA has issued no standards or health guidelines when it comes to e-cigarettes and vaping products. Now, I'll also add that there's been some promising activity in Oklahoma with the Cherokee Nation filing a lawsuit against Juul and 22 other companies that create and market e-cigarettes. And they really point to this U.S. House Subcommittee report that states that Juul had actually used Native American tribes as, in their words, guinea pigs for the testing and introduction of their products, selling starter kits to tribal governments, and really, as Chief Chuck Hoskin says in this article, Juul created a vaping epidemic throughout this country, and it is hitting Oklahoma tribes and Oklahoma youth particularly hard. Now, the American Lung Association does have some resources if you are concerned and trying to do something about vaping, particularly youth vaping. We have several new vape-free schools initiatives. One is In Depth, which is an alternative to suspension. We know that tobacco companies spend about $170 million marketing their products in Oklahoma alone. And we really view youth and kids who pick up those products as victims of that effective marketing industry. And so we don't want to see youth penalized. We don't want to see them kicked out of school for being victims of that effective marketing. And so this in-depth program is an alternative suspension focused a lot on education and healthy alternatives. We also have NOT, or Not on Tobacco, which is a youth tobacco and vaping tobacco cessation program, which you can be trained to be a facilitator in your community and take that knowledge and information back. We also have a great website, talkaboutvaping.org, which is full of resources encouraging parents to have those tough conversations with their kids about the dangers of e-cigarettes. From an advocacy perspective, this next year we will be working with state lawmakers at the Capitol to try to create a state licensure and taxation on e-cigarette products. Unlike your commercial tobacco products would have a whole system of distribution and the state tracks them and knows where they are, that system does not exist for e-cigarette retailers. So when you think of all the many vape shops on the corner, the state currently does not track or license any of those retailers. And of course, we'll continue to work to hold the FDA accountable to their mission, which is to protect our health. So the key takeaway is that there is no safe tobacco product, commercial tobacco product, and that includes e-cigarettes. The e-cigarettes in the marketplace have not been reviewed. The only thing that we know is safe for clean lungs, is clean air, healthy air. And if you are, a commercial tobacco smoker and trying to quit, there are safe and effective cessation products. E-cigarettes are not one of those. They have not been submitted or approved as a cessation device. Lastly, I want to talk about smoking and COVID. So first, we want to think about what COVID does, and COVID really attacks the lungs. It attacks the cell lining in the airways that catch and clear things out, leaving all of that stuff to kind of stick and stay in your lungs. And we also know that people with serious underlying health conditions like COPD, lung cancer, are more likely to see worse outcomes if they become sick. So while we can't establish that link of smoking to COVID, what we know is that the kinds of diseases that smoking cause make you more susceptible to having worse outcomes if you were to get COVID. Another question we get is, can I get coronavirus from secondhand smoke? Well, again, the science is still a little early on this, but we got to think about the two different aspects of secondhand smoke. That side stream smoke, which comes off a cigarette, that's only going to give you potentially lung cancer. You can't get COVID from that. But that secondhand smoke that's exhaled, that can contain aerosols and droplets that could carry COVID. And so we continue to encourage folks to follow social distancing, and particularly wearing a mask and social distancing from people you see who are walking around smoking or using vaping products. So the key takeaway, again, cigarette smoking and vaping are linked to lung inflammation, reduced lung and immune function, and people with those lung diseases and lung issues are at higher risk of complications if they are to contract COVID. And we know that smokers specifically are likely to have a much higher risk of developing infections associated with severe cases. So that ends my presentation. I will pause for any questions if there are any, or if we're set up for that. If not, I'll pass it back.
So we don't currently have any questions. If you have questions, feel free to put them in the questions box or in the chat. And I'm not seeing any come through right now, so maybe we can circle back at the end. And if you're able to answer questions at the end, Charlie.
Perfect, I appreciate it. Thanks, Josh.
Thank you so much, Charlie. Up next, we have Missy Tracy, who is the Municipal Relations Coordinator with Ho-Chunk Gaming Madison.
Good afternoon. Thank you for that introduction. And it's a pleasure to be here with you all this afternoon. And I thank you for your feeling the importance to listen to what these folks have to say about smoking, and it particularly in our tribal casinos. I'm just going to tell you the story of our journey with this in hopes that it will encourage those of you considering going smoke-free, and for those of you who aren't, that you really seriously consider this. So I'm going to start way back in July of 2010 when our municipality, Dane County, located in Madison, Wisconsin, a place that the Ho-Chunk people refer to as Dejope for the 4 lakes here. They came out and there was a smoking ban. You couldn't smoke indoor environments. And at that time, we continued to allow our guests to smoke. Then November of 2014, well, we offer comment cards to our guests at our casino, and we started noticing a trend of people complaining about the indoor air quality of the environment because of the smoking. So our executive manager, Dan Brown, who also speaks on our experience, decided to conduct a survey to our clientele to test, find out what our guests wanted. What were they, did they want us to continue to offer smoking in our casino, or were they truly interested in going smoke-free? And when we got our results back, we were very surprised to see that 70% preferred a non-smoking environment versus 30% who wanted to continue to be able to smoke in our casino. So we decided to, our executive manager went to meet with our all of his managers here on site to begin talking about this. And all of our management they were adamant and in support of going smoke-free. From that point, our executive manager went to our tribal leadership in our tribal government. He spoke to the president, he spoke to our legislature, and he spoke to the executive director of business. And he told them of what we were proposing to do at our casino. And they pretty much said, you know your market, we're gonna leave this decision in your hands. And so the responsibility lays upon your shoulders, whether it succeeds or whether it fails. That, anyone who is familiar with our casinos know that in the past, historically, gambling and smoking go hand in hand. So this was a significant risk that he was taking should he decide to go ahead and really pull the plug and offer a smoke-free, totally, completely, 100% smoke-free environment. So in June, we made the decision to go ahead and decide that as of August the 1st of 2015, we were going to be completely smoke-free, not air purification, not putting up glass windows, completely smoke-free in our building. So in June, we notified our clientele that as of July 31st, that was going to be at midnight, all smoking ceases in our facility. So what we did offer though, because in this service industry business, you want to provide the best service for your clientele. So we realized that we do have smoking customers. So we provided an outdoor, detached from our dwelling, smoking hut for our smoking clientele. And should they want to smoke, they need to leave the building and utilize the smoking hut so that no smoke could permeate back into the building. So in August the 1st, on August the 1st of 2015, we went smoke free. And I will be honest with you, for the first 3 months, we saw a dip. The first 90 days, we saw a dip in our revenue. But I offer a piece of advice that 3 months is not enough sufficient time to analyze whether or not your decision is successful or a failure. You really need a good 12-month run to determine, you really have to go all in. So we stuck with it, and I am so happy to say that 15 months later, not only did we see our revenue climb, but it exceeded our revenue prior to the 15 months earlier. We exceeded all of our revenue. And what we have found is that's, a different type of clientele, a clientele that has ancillary income rather than spending on tobacco products, that perhaps they can spend that on their choice of entertainment by coming into the tribal casinos. So we are really happy with that, with our decision, particularly coming into this virus, because we've seen, the shuttering of our tribal casinos nationwide and in the country, and that certainly has had a significant, just an incredible financial impact on all of our tribes. But when we make the statements that we want to offer a clean and healthy and safe environment for our guests and our employees, we really have to mean that. And that means offering a smoke-free environment. Your environment can't be healthy as long as you offer smoking and secondhand smoke in your facility. So also, it's a wonderful, I know that everyone has sanitized and disinfected their facilities, protecting the investment that of all of the dollars that we poured into making sure that we had safe environments. So cost savings there. Cost savings, as was Charlie mentioned, was, you save on your employees calling in sick and having illnesses and going to the doctor and your health insurance costs and the costs that it saves you in changing out your shifts and all of those things, as well as the HVAC systems, as well as your environmental services staff on your gaming floor having to dump ashtrays, dirty ashtrays. So all the way around, it is the right decision. And I promise you, you will not regret it, and you won't go back, because it really is a much more pleasant environment. And truly, to offer a standalone smoking hut, it really isn't that big of a cost to people. I believe that we spent estimated $15,000 to do that, and versus what we're saving, that's a relatively inexpensive place that you can offer your guests who choose to smoke. But I also offer too the staff that expectant mothers and their unborn children. We don't want to expose any of our Native mothers or non-Native mothers, any mothers, to this secondhand smoke. Think about those babies. We want to protect our youth. It's our responsibility. We want to protect our environment. It is our responsibility as Native people. So I just encourage everyone to really consider just going ahead, and now is the perfect time, because everybody's experiencing changes, and nothing is ever going to return to what once was. So, but your guests are truly going to embrace the change. They'll be okay. They'll come back, because really it's about that guest service, and it's about the wonderful entertainment destination that you provide your clientele. And with that, I just encourage everyone, and I thank you for your kind attention.
Thank you so much, Missy, and thank you for sharing your journey at Ho-Chunk Madison with your smoke-free journey. So up next, we will throw it over to Isham, who is a consultant for Americans for Nonsmokers, right?
Hi, everybody. My name is Clinton Isham. I'm on a little early, so I guess I could talk extra long, which is fine by me. I'll try to go slow and not rush through my words. Thank you, all the panelists, for being on, and happy 5-year anniversary to Ho-Chunk Gaming Madison for being successfully smoke-free for 5 whole years. And thank you for all the attendees for logging on today and watching this webinar. I think I will start in story mode too, to kind of just go through really where we were at before in this whole movement, where we're at now, and where we hope to go moving forward. So I'm from northern Wisconsin, and I currently live in Nashville, Tennessee. But I've worked in northern Wisconsin for quite some time. And back in 2015, I heard that Ho-Chunk Gaming Madison was going smoke-free. And at that time, it was huge, huge, huge news because there were not that many tribal casinos that were smoke-free. At that time, there was around 3 or 4 in total. So I tried my best to get a meeting with Dan Brown at Ho-Chunk Gaming Madison, and he was very receptive of me coming down. This was a long time ago when we got to have in-person meetings and we didn't have to have Zoom meetings. So I went down, and Dan was just, it was really inspirational, and the things that he had to say about the process of going smoke-free was really amazing. And I got to have a tour of the casino, and what I proposed to Dan right away was if we could create a video about Ho-Chunk Gaming Madison, and just to be able to share with everybody the great things that are happening, and in Dan's story, which was that them going smoke-free was financially successful. And so I worked really hard trying to pull a bunch of strings, and I was able to get funding from the American Public Health Association, and then contract with some really cool videographers out of Wisconsin that were already doing really cool cultural videos throughout Wisconsin on different tribes. And we were able to get some dates to film at Ho-Chunk Gaming Madison Casino. And we did interviews with Dan. We did interviews with some of the staff at Ho-Chunk Gaming Madison. And then the video kind of evolved to be more than just sharing Ho-Chunk Gaming Madison's story. We also covered traditional tobacco use and other tribal initiatives that were happening at the time for smoke-free policy change. And after we finished the video, I didn't provide the link today, but if you guys Google American Public Health Association tribal casino smoke-free, it should pop up, and I will share it at some point at the end of the webinar too. I'll try to get it up for you guys. Anyways, the video was really successful. We disseminated it throughout a bunch of different organizations and channels and on social media and different things. And I think at that point for me, something really sparked with really trying to promote this in a much larger way, or trying to share this with other tribes and other tribal casinos, mainly because, yeah, you know, the health component was very important, but there's this notion that financially smoke-free casinos don't work, and it's just simply not true according to Ho-Chunk Gaming Madison, and also a number of different reports that were kind of popular at that time. So fast forwarding to 2019, 2020, I started working as a consultant with American Non-Smokers Rights Foundation. And we were doing similar things. We were working with Ho-Chunk Gaming Madison, trying to get the message out more. And things were really kind of stagnant, I think, at the time. But we were still doing really great things with Dan Brown and Missy Tracy. And you know, we were very grateful to have their support with trying to share that this type of initiative does work. So COVID hit in early spring, and it was really worrying, I think, for a lot of people, a lot of organizations, a lot of tribes, and especially a lot of tribal casinos, because as you guys know, mostly all of the tribal casinos shut down, and they've never shut down since opening, like in the 80s and the 90s. They've never once shut down. And these casinos, they provide a critical revenue, a crucial component of the revenue that goes into tribal healthcare, tribal education, tribal programming, programming services for elderly people, so many things. And we had a lot of conversations at American Non-Smokers Rights Foundation about, you know, what is the best way that we can support tribes right now. And before COVID, honestly, there was a fine line that needed to be walked when we approached tribes, because as an outside entity, it's difficult to go and tell a tribe, hey, you need to do this, right? Like, you need to implement this policy. It's not something that I like to do, and I don't think it's something that any public health or advocacy organization likes to do. And so we tried to respect that line as much as possible. But when COVID hit, I think there was more of an urgency, because the world was really awakening to this thing that never happened before. And it was almost like this brand new movement that was happening around health protection, and there was so much unknown that was happening. And so what we decided to do at ANRF was to create some mini videos or some resources that just simply talked about the financial health benefits and the financial benefits and the health benefits of reopening smoke-free. And we tried to convey that message in a very respectful way that respects tribal sovereignty, that respects tribal leaders. And these videos are available on YouTube, or if you look on American Non-Smokers Rights Foundation webpage, we have those videos available. But we did a huge campaign in sharing all these videos, and very early on, there were some casinos in California that were starting to pop up that they were going 100% smoke-free when they were going to reopen. And they started announcing this on Facebook first, the actual casinos themselves. And if you looked on these Facebook websites where they posted them, and you looked at the comments, there were thousands of comments, overwhelmingly positive, from patrons and from community members saying, yes, we really want this to happen. We want you guys to open, and we want it to be as safe as possible, and we want it to be smoke-free. So we realized like something good was happening, right? Like there was this awakening happening, and from there, like it was really like a huge collaboration between a lot of different organizations and a lot of different people in trying to get this message out there to as many tribal casinos as possible and to as many tribes as possible. And the National Native Network helped with a lot of that. Oklahoma, Navajo Nation, different groups that we worked with in the past. And we did this mainly through sharing stuff and through webinars. These webinars have been really awesome. We had our first webinar that we did with it was like a national webinar that we held, which that one was in May, and this one was with the National Native Network and Navajo Nation. And we were just at that point talking about the couple of casinos that were reopening smoke-free and really trying to congratulate them and just reach out to as many advocates as possible about what you can do to then go out to your local tribes and share these resources and ask them to consider reopening smoke-free. And I really didn't have like a step-by-step action plan, but I do today, and I'm going to share that with you guys shortly and go over it very quickly. So we had that webinar in May, then we had another webinar in August with the Great Plains Chairman's Health Board, and that one was very similar. It was just it was amazing. We had a bunch of attendees, and it was basically the same call to action. It was just trying to place an urgency on the situation happening, and we wanted the attendees to just feel energized about going out and reaching out to as many tribes as possible and just sharing all these good things that are happening. Oh, and by the way, in August, there was like over 100 tribal casinos that have went smoke-free at that time. And so it was, it was just really, really amazing. And so as of today, they're at this webinar that we're holding today with the Oklahoma Tribal, or the Southern Plains Tribal Tribal Chairman's Health Board, there are over 135 tribal casinos that have reopened smoke-free. So at some point, I think tribal leaders and gaming managers and casinos, they're already thinking of this, right? Like they're already thinking, what is the best possible way to reopen to keep our customers and our employees safe? And so there's already a desire to do that. And I think what our job here and what we're trying to do is to kind of help push them forward in kind of saying, the way to do that is to enact 100% smoke-free policies at your casino. And I think through our messaging that has really been able to happen in a really great way. So with all of that said, I wonder, Josh, can you pull up the action steps that I had sent on the webinar screen?
I will try and pull it up on my screen, but I do want to note to everybody that under the Downloads tab on the GoToWebinar toolbar, you can download this information. I will try and share it on the screen in just one moment. And also, I wanted to give a quick heads up, Clinton, to wrap it up here in just a few so we can answer some questions, because we've had some questions come in.
Great. Okay. I didn't know I was talking that long. Went by pretty fast. Sorry. Oh, okay.
You're totally fine.
All right.
I was just rearranging a few minutes up.
Okay. So the action step, you guys could download it. I put it together, and it's pretty. It's really straightforward. There's a quick message on here, and it's basically what I just said. There's an urgency for this to happen. It's very much possible. There's a bunch of tribes that are already doing it, and here are some steps that you can take to kind of make this happen in your community. So first, I talk this message, I guess, is specifically to tribal leaders, and I think tribal leaders, again, like a lot of tribes are already doing this, and so it's just about like vocalizing it and saying it explicitly, saying it, just putting it out to the universe, and just putting that energy out there. So the recommendations is just to meet with your casinos and insist that that your tribal casino goes smoke-free if it hasn't opened yet, or if it's already open, to go smoke free. A big part of this is to communicate with your constituents. There's a lot of people that may not think it's fair to be smoke free, because casinos are always, for a long time, have been known as these havens for people to come in and smoke at, because everything else is smoke free. So you want to have the right messaging to communicate with your community and your patrons about why you're going smoke free. The next piece is for gaming managers. Again, this is the same thing. Communicate with your employees, with your patrons about why it's important. I think casinos, from the conversations I had with different casinos, they are already having conversations with the casinos in their regions, in their areas, on things like when to reopen and kind of at what capacity they're at and different rules that are in place. They already do all of these things really great on their own. So again, these are just, you know, suggestions. And we talked about the cost savings. We talked about lower health insurance premiums and things like that. If you're in the health field and you know, like you work in a health clinic and you know of a casino that is smoke-free in your area, you could contact them and see if they have cessation courses at that casino. Ho-Chunk Gaming Madison provided tobacco cessation courses for their employees when they went smoke-free, which is really important. And then health advocates. I always get asked the question, and like, what health advocates, who, especially those who are non-tribal, what they can do to help tribes. And the big message that I try to push is just know your local tribes and know who these tribes are, know where they came from, and more importantly, you know, research this stuff and research like the land that you live on and which tribes historically resided on that land and which tribes are currently there now. And these things, that background information, is going to help you tremendously when you walk into any room or Zoom conference now and try to, you know, collaborate or work with other tribes. They're going to really know that you've done your background, your homework, your research, and all of that is just around respecting tribal sovereignty and respecting tribes in a really good way. Anyways, I will wrap it up for now, but so I have on the very bottom for assistance with any of these steps. You guys could go through all of them. I have links to all the tribal epidemiology centers that help with technical assistance, such as surveys or evaluation things. Also for TA, you have different tribal health boards, including Southern Plains Tribal Health Board. And if you click the link, it directs you to the all of the tribal health boards. And then, of course, American Nonsmokers Rights Foundation. And I could update this for National Native Network. Sorry, I was in a rush when I made this, and it will definitely be updated. But thank you guys so much for listening. And if you have any questions, please let me know.
So thank you everybody for all of the words you've shared. Thank you, Clinton and Missy and Charlie and Aaron and Chris. All of your words have been very helpful. So we do have a few questions. I did want to throw a question out. I'm going to aim it at Charlie, but it could go anywhere. And there's a question asking if tobacco taxation will change much for Oklahoma revenue with the McGirt case and tribal jurisdiction being reaffirmed by the Supreme Court. And so I recognize that I am throwing you on the spot, Charlie.
Sure. The short answer is I don't know. And I think that Supreme Court case has led to a lot of questions that we won't know the answers to until the next few months, year, as they're kind of figured out. So that is a big question that could potentially impact tobacco taxes. But I will say one thing to note that's great about Oklahoma is those tobacco taxes do not pay for tobacco control programs, cessation programs, Quitline, and others. Those are funded purely by TSET, which is protected by the state constitution. But when it comes to whether that Supreme Court case will impact tobacco tax collection, I don't know.
All right, thank you, Charlie. Was there anyone else that wanted to chime in about the taxation question? All right, so there was another question asking Oh, there was a clarifying comment that it just that TSET is under threat by Oklahoma legislature this upcoming session. So I think that that might provide some more context, Charlie. But thank you for your answer and your response. There is another question that came up, and I wanted to pose it to the whole group. So the question just asked if any tribes that have went smoke-free have done any sort of ROI or return on investment. Is anyone aware of that taking place anywhere?
I haven't heard any yet. But as Missy said, you know, it's only been a couple of months, so it's probably a little early to make those kind of predictions or to even examine it just yet.
Yeah, that is a fair point. And I know that sometimes in our communities, we get so caught up doing the work that we don't necessarily always have the time to, we don't always create enough time for the evaluation side of things to, you know, really get the return on investment. So, you know, to follow up with that, I am not aware of any tribes that have done a return on investment for going smoke-free in their casinos. But this is me urging and, you know, politely sharing with anybody who could be listening that a return on investment, if your tribal community has gone smoke-free in your casinos, that is something to think about and to critically look at, because as Missy and pretty much every panelist has brought up today, that our world is fundamentally different now, living with a very virulent respiratory disease. And so smoking in places like casinos will forever be an issue. Here is a specific question for Missy and Clinton. Were employees of casinos that went smoke-free offered any quitting support services? I know Clinton did talk about that slightly, but here's another moment to address that more specifically.
Yes, as Clinton mentioned, yes, we did offer smoking cessation classes here. And then we also surveyed, and I don't have those results, but we did do a survey, I believe was last year, and it surveyed our employees about the non-smoking environment. And we learned that the hiring of some staff, they wanted specifically to come here because we provided a smoke-free environment. And also some other staff members indicated that it helped them to quit smoking. Number one, because we offered the program, but I think even more so because we weren't making it convenient for them to smoke. So it really provided that additional incentive for them to stick with the program of, you know, really quitting. So those are bonuses when you're looking to recruit employees. And the one thing I did forget to mention was that last November, we banned e-cigarettes. So we don't have any smoking in our facility, whether that is cigarettes or electronic cigarettes.
Missy, can you just do a quick explanation or explanation of how many sites Ho-Chunk has in Wisconsin and update on those other sites as well, just really quick?
Sure. Well, we have a total of 4 casinos that offer that are casinos, and then 2 are ancillary sites so total of 6, but and 1 with our facility being the only Class 2 facility dedicated to Class 2 gaming. And they are currently non-smoking, all of them, but I'm hopeful that they will remain that way, but I'm not sure. You know, we're still not back to you know, full capacity yet. We're still operating. Our casino here is at a 50%. So, and we're also not back to our original 24/7 hours of operation. So everything is kind of, you know, in transition, so to speak, until we know what we're really dealing with. And you know, unfortunately, Wisconsin is a hot spot right now, so we're really keeping a close tab on this virus. but so happy that we're able to provide a healthier environment for our folks, not only sanitized and disinfected, but also smoke-free, to ensure that it is the, I feel the safest here. I go between my house, my home, and here, and I don't have any ambivalence about being here, and it's comfortable and a really nice environment to work in.
Thank you. There is a question of how often the list of smoke-free casinos is updated. Does the casino reopen status need to be permanent to be added to the list? And so that's not really a question for me. That's an ANR friend, Clinton or Char.
Sure, I'll jump in there, Clinton. So our list is updated every single day. If there's a new casino that's going smoke-free, we add it to that list that day. So thank you for the question. It's not easy to do, to keep on top of the news and updating each and every day, because some casinos will go off if they suddenly decide to allow smoking or something like that. And do you need to be 100% permanently to be on our list? And the answer is no, not yet. You just have to make the decision now to be 100% smoke-free indoors, and then we hope, and we will do everything we can to reinforce that decision so that in the future that tribal nation will see the benefits of being a 100% smoke-free indoors casino. So we're starting to see some really wonderful things happen along those ways, where leadership from tribes are leading the way, and they are forging the path to show other tribes and other casinos, even in commercial casinos, non-tribal casinos, that the right thing to do is to go 100% smoke-free. It's pretty wonderful.
Thank you, Char. So there's actually a couple questions, but I also want to be very respectful of everyone's time. So there is a question asking when Clinton will have another webinar with NIGA. So I'm not sure if you have anything in the works, Clinton.
That's funny. Yeah, I'm not. I try to communicate as much as possible with sharing information and resources to NIGA, but yeah, I'm not sure. If anybody wants to set up an interview with me and them, please do it, or sending me, help me make more connections there. I'll be more than happy.
Perfect. So there is a question, would one or more casinos be interested in having an ROI study completed if offered? So I can't speak because I don't work at a casino, so I'm uncertain, but I do imagine that there may be some interest, especially when we talk about things like research and evaluation is often out of reach for our casinos, because it's not necessarily an area that they have a specialty in. So I'm sure that there probably is some interest. And there is just one, there's a question about cessation programs that are suggested or recommended. There are quite a few that are evidence-based. I know American Lung has one. Like there's a couple different varieties. So what I would suggest is asking other tobacco programs in your area what they are using, or how which curriculum that they're using, because it's typically chosen in a regional sense for a lot of different programs. I did want to give one last moment to Charlie. He had a clarification that he wanted to offer, and then we'll wrap it up after that.
Yeah, thanks, Josh. Just wanted, I misspoke that there, some of the tobacco tax does go toward tobacco control efforts with the Oklahoma State Health Department. Just wanted to clarify that some of the tobacco tax does go toward the State Health Department. That's all.
Okay, thank you so much, Charlie. Thank you everybody for joining in today. It was so great having all of you. Thank you to this wonderful panel who shared a lot of information with us, and we learned a lot in the last hour. So thank you all so much. You take care of yourselves and make sure you're going into fall in a good way. Thank you, everybody.
Thank you, everybody.